everyone, welcome back. My name is Amanda Gold, and today we're joined by Travis Mickelson, child and adolescent psychiatrist and the Associate Medical Director for Mental Health Integration here at Intermountain Healthcare. Today we're going to be discussing mental health and returning back to school, what that means for you as a parent and what that means for your children as well. Travis, thank you so much for joining us. We really appreciate it.
You're welcome. It's nice to be back.
Nice to see you as well. So I want to start off this discussion about masks. We know that masks are mandated for K through 12th grade in the state of Utah, and I want to talk about what that means for our children. How do we make them feel comfortable wearing a mask and understanding the importance of it as well?
Yes. So this has been such a difficult time filled with so much uncertainty, yet one of the things that we feel very confident about in a public health way to help protect our community is by wearing masks. So like the masks that we're wearing, they're not always comfortable and easy to get used to. But over time, I think what we've both noticed is we've been able to get more comfortable with wearing them almost all day long. We really need, as parents, to role model for our kids the importance of wearing masks. And for our younger children, really help them in this process. We have a few weeks before school is going to be starting. Now is a great time if our children have not been are in the habit of wearing masks to start practicing that. For younger kids, I've had a lot of parents I've talked to that are buying masks and having their children decorate them so that they become kind of something special and unique. But one thing for sure is that our kids are very adaptable and very resourceful. And if they see us as parents wearing masks and getting comfortable and appreciating the value of wearing masks, our kids will follow our lead.
I think it's great that you mentioned the ability to decorate a mask for a child or have that little activity. I think it's important when a parent picks out or helps their child pick out a mask and say, hey, which one do you like? It makes them want to wear them more. I like this one because it's blue and I like the color blue. Mm-hmm. I think if you give them a fun connection to the mask, it'll make it a little bit easier as well.
Yeah, I think you're right about that.
So the other thing I really want to discuss is back to school. What happens in that couple of weeks when we actually go back to school? There's lots of decisions being made with all the different districts about choices. The American Academy of Pediatrics just released a pretty great statement and resources about what's happening, and I want to break them down a little bit.
Okay.
One of them was classroom changes. Now kids aren't going to be very close together. They'll be 3 to 6 feet apart, and they won't have as many items in the classroom that they share. What is the impact of something like that on a child?
Well, you're right, Amanda. One thing for sure is when our kids return to school, it is going to look different and be a different experience than I think they've ever had in the past. And again, a successful reintegration of our kids back into school is going to entail us as a community following these standard kind of guidelines, wearing a mask, washing our hands frequently, and maintaining that 6 feet social distancing. And so as parents, we are anxious about what this is going to be like for our kids. And we can be confident that our school leaders and pediatricians and administrators of our school districts are putting a huge amount of time and effort into creating a safe environment for our kids to return to school. And so how that is going to look for an individual child is going to be different on that individual child. But one thing for sure is that kids are very good at following rules, especially if they're being role modeled by the adults in their lives. Now, there's going to be some transition, and some of our children might struggle more with those transitions. And so it might be a reasonable idea for a parent, if you think your child might struggle with the social distancing of the desks, is to maybe try to create an environment similar to that at home and give them some opportunities to do some reading or some mathematics, or they can kind of practice and just get used to the fact that they're not going to be so close to all of their friends. But that social distancing is a very general rule that I think everyone who goes back to school is going to notice that within their classroom.
Another thing that the American Academy of Pediatrics mentioned was what happens in buses, hallways, and playgrounds. So with buses, I think it depends on the district. I know there's talks about not having them full or having them full, wearing a mask. And then with hallways, social distancing, playgrounds, it'll be very different. If you have a child who is that age who is used to recess, how do you tell them about what's going to happen? They're not going to be able to go play with their friends. They have to keep their mask on. What's the ways you can walk them through that process?
Yeah. So again, I think because this is new and it's going to be a transition, any information we can gather as parents to get the details of what this will look like for our kids at our particular school, we can create opportunities to help them get used to what that environment is going to be like. We can let them know that when they go onto the bus, they're likely not going to be able to sit next to their friend. And in fact, there might not be anyone sitting in the row ahead of them or behind them. And for our kids who are walking down the hallway, they might learn that you need to walk on the right side of the hallway. There might be almost like one-way lanes. And I imagine also that there will be staggering kids going into and out of the hallways and also into the playgrounds. And so again, as parents, if we can get that information, since our kids are going to be asking those questions and are going to be thinking about that, we can start to give them that information and prepare them for what it's going to look like. Now, schools are still going to have and provide access to their kids to be outdoors. In fact, I know that some schools are even looking at doing some of their lunches and meals outdoors, since there's a relatively less risk of contracting the virus if you're outdoors versus in your classroom. So these are all changes that right now our school districts are putting a lot of effort into developing these protocols and guidelines. And there's going to be plenty of opportunities for us as parents to be a part of those conversations so we can learn what to expect and then start to create those opportunities to help with that transition.
And what resources are out there for parents? How can they find out how best to talk to their children or what their district is even doing? Is there resources and places that they can go to?
Well, there are, and I would imagine, I know as a parent of two school-age kids, we have received several emails that have invited us to updates, to morning updates, where we can call in and get some updates on here's what we're looking at in terms of this school year, and it gives us as parents opportunities to ask questions, and so that we have a better sense of what's going on. And so if a particular parent hasn't heard from their school, then I would be proactively in contacting their school to start to get that information, either the school or the school district. I know in the conversations that I've been a part of that there is a huge amount of effort going on right now into creating a very safe way for our kids to go back to school.
So I want to talk about the parents' decision on whether we go back to school or we keep our children home for in-person. How can a parent help themselves not feel better, but feel okay with the decision they're making, whether it's sending their children back or not? And how do we calm our own fears about what's happening with school?
Yeah. I think that's probably the biggest question that parents and pediatricians and teachers are thinking about right now. And we're in a different world in terms of returning to school this year. Oftentimes as a parent, when I'm faced with a decision of A versus B, I'm able to get information about each of those options. And one of the things that I tune into is that emotional feeling of what feels right. One of the things I've noticed as a parent, and I'm sure other parents share, is whether my child is staying home and doing remote learning or going to school and doing in-person learning, neither one of those options feel completely good to me, because I know that there are pros and cons of both of those. And so I think that's one of the things, using that emotional sense as a compass to guide us in what's the right decision for us, might not be there as we're used to. And so what that means is I think we really have to trust the information from people like our school leaders and our pediatricians Make sure that we can sit down and really evaluate the pros and cons for my family. I need to take into consideration the health risks that my family has. I need to take into consideration, are there any special education needs that my child wasn't really able to get as well doing remote learning last year? And then I need to weigh out those pros and cons and then be able to make a choice that, again, I'm going to have to be flexible and trust that, not only trust the leaders that are helping to guide and educate my child, but also know that this is an ever-changing situation and I'm going to need to be adaptable, but because perhaps the information my pediatrician and my child's school is giving me today might be different than it is in 2 weeks. And I'm going to need to make sure that I can be flexible and adapt to those changes.
I also think it's important as a parent to kind of give yourself a little bit of a break too. You're making, like you said, a decision that is probably not great one way or the other, but don't judge yourself on the decision that you're making. And if your friends make a different decision, don't feel like you have to make that same decision as well. And that brings me to our children too. So you, as a parent, you make this decision to decide, okay, my child is going to go back to school. How do you, as a parent, help your child with their developmental skills? Even if they are going back to school, it might not be full time. How do you supplement that as a parent and kind of help them through this?
Thanks for bringing that up, Amanda. Your comment about feeling comfortable about the decisions that we make as parents and not worrying or feeling pressured by the stigma or by pressure or being judged by other families, I think is really important, because there just isn't a right way to approach this in general. We do need to feel comfortable with making these decisions for ourselves within our family. In terms of how we can help children, I think, again, going back to some general principles, I think one of the first principles that's really important as a parent to remember is no one knows our children better than we do as parents. And so if my 12-year-old son was struggling with anxiety and was having some school avoidance behavior and having a lot of physical symptoms like headaches and stomach aches that made him not want to go to school, if that was something that my child was dealing with pre-COVID, before this issue, then I should be able to anticipate that that's something that's going to be happening in the future. And so in a time of uncertainty, when we don't necessarily know what's going to happen, we need to remind ourselves what we do know. We know our children best. The best way of understanding where our children are in terms of how they're coping with the anxiety or fear of returning to school is to have opportunities to communicate with them. And as a parent, sometimes I want to communicate with my 16-year-old daughter at 8 o'clock in the morning right before I go off to work because there's something I want to talk with her about. And at 8 o'clock this morning, she reminded me that she wasn't quite in the mood to have this conversation. And so it's important for me as a parent to provide many opportunities and for these conversations to be had. It's going to be very important for me as a parent to validate the concerns that my child has. And rather than just saying, oh, don't worry about it, everything's going to be okay, actually helping them to understand information that we have that we're going to use to make decisions and specific things that we can do to really reduce risk and to keep ourselves and our families and our communities healthy. When it comes to safe school, we're not just making decisions for what's best for ourselves and our families, but for our school community as a whole, which again is why wearing a mask is so important, and for adults to role model the importance of wearing masks. That's one of the best things that our kids can do, so they can feel confident that they're going to school and keeping themselves and their friends and their teachers safe.
Like, we're wearing masks right now. We're setting that example that we are 6 feet apart, but we are inside. So we need to set that example as a parent or as a friend that it is important to start wearing masks now. And like you said, we have a few weeks till school starts. So how do we teach them now and model that behavior so it helps them in the future? And I want to talk about parents' anxiety a little bit too. How do you as a parent, or how do parents come up with healthy coping strategies when they're facing anxiety over school or maybe just in general?
So again, it's a great question. We all appreciate that whenever we're faced with uncertainty, our brains tend to want to answer that question, that uncertainty. And at times, our brains will answer that question in a way using inaccurate information. And so one of the best ways of managing the anxiety that comes with uncertainty is to take a few deep breaths and remind ourselves of what we do know, what information we do know. And if we are needing information, using those reputable sources, such as the CDC, such as the American Academy of Pediatrics website, such as our website through Primary Children's, including our pediatricians, using them to help give us the information that we need so that we can make those decisions. And then I think more now than ever before, we've appreciated the value of mindfulness. Mm-hmm. When I'm thinking about and worrying about what's going to happen with my kids when they go to school, I want to be very mindful and be very focused on that. But I also appreciate that it's not going to do me any good to have those worry thoughts be going on in my head all day long when I'm talking with you, mm-hmm. when I'm seeing my patients, when I'm driving home from work. So we need to give ourselves permission to worry and think about these things. We need to remember that there are people out there as resources that can help us. But we need to be really good with giving ourselves protected time and allowing ourselves to not think about this and worrying about this all day long. So and again, no one knows better how to manage your anxiety than you. And so you know your coping strategies. Mm-hmm. You need to give yourself permission, and I need to give myself permission, really scheduling those opportunities so that we can have those moments that can help us to calm down, relax, to cope, to regain our resilience, so that we can be more effective when it's time for us to really be thinking about and even worrying about what are things going to look like when we go back to school.
You mentioned a resource to the Primary Children's resource. I just wanted to give everyone that information. So we created a guide for back to school, and it has a risk assessment that you can look at as a parent. There's some information about what to look at, and we'll post that after this Facebook Live so you can gain that. But it has some really great resources from not only Intermountains pediatricians, but we also worked with the University of Utah. So it's a really great resource, and we hope people look at that and take that into consideration when they're deciding what to do as well.
Please do. And our pediatricians, I just got off of a call this morning, and there were hundreds of our state's pediatricians on this call. They are putting so much time and effort into being prepared and having the time to be able to have these conversations with their families. So please reach out to your pediatrician. They are ready and wanting to be a part of this conversation because, again, they appreciate that the right solution or right answer for one family might be different for another family, and they're ready to help us as parents weigh out the pros and cons, and also remind us of some general principles that are going to need to be in place in order for us to be successful with opening schools, wearing the mask, social distancing, hand washing, small cohorts. And we've created these guidelines that are going to be helpful for us regardless of what this is going to be looking like.
You mentioned your children a couple of times during this Facebook Live. As a parent and as someone whose job relies a lot on children, how did you make the decision on what you're doing with your children for school, and what were those types of conversations like with yourself and your family?
Yeah. Well, thanks for asking. I have a 16-year-old daughter who's going to be a junior in high school, and a 12-year-old son who's going to be going into 7th grade. And they both did okay with remote learning last year, but they really missed out on some of the social aspects of school. both of my kids missed out on several big events last spring in their sports. Their ski championship was canceled, and the soccer season was canceled, and so they were really looking forward to returning to school this fall and having things go back to normal. My daughter was really looking forward to the theater season opening back up. And we've had a lot of conversations, and they've had a lot of disappointment in realizing that some of their hopes for what this next school year was going to look like is quite different than what the reality is. And so we've had these conversations. I mentioned that this morning, I was wanting to have a conversation with my daughter this morning, but she wasn't quite in the mood, which is okay. I'll try again tonight. But when I talked to my son this morning, one of the things that he realized is that it might be difficult for some of his younger aged friends to really follow some of these rules, like wearing a mask and maintaining that 6 feet distance. And so he made a pledge today. He's going to try really hard to start practicing wearing a mask more often, and also practicing helping his friends also if his friends aren't following certain guidelines that he knows are going to be rules for him starting the school year. This is going to be a great opportunity for him to practice being a leader and being a leader for other kids, because he could be a good role model for them in how we should act. So we're trying to create opportunities to be able to listen to the concerns of our kids, give them good, accurate information, help them practice and transition to what it's going to look like, where they're going to be wearing masks all day long. And so as a parent, our particular school is as of now, is looking at a hybrid type of a system where our kids are going to be broken into cohorts of about 10 kids. And they're going to be spending part of their time on campus and part of their time doing remote learning. And our family does not have any health conditions that make us more vulnerable. And we don't have our elderly grandparents living with us. And so we're in a situation where we feel comfortable with having our children go back to an in-person type setting. One of the things that we're really trying to highlight for our children is this decision about wearing a mask, maintaining the social distance. It's more than just us taking care of our family. What I'm trying to help our kids realize is that if we have children that are going to school with symptoms, if we have children that are going to school and spreading that virus, that could cause the school to need to be shut down. Mm-hmm. And so our actions not just can affect our family members, but can affect our entire school community. And that's a lot of pressure. That can be a lot of pressure when we think about it that way. I think it's important to lay out that reality, but at the same time, remind them that these are the things that we can do to really do our part. And I'm going to need to make sure, and my wife, we're going to need to make sure that as we go through this process, that we keep checking in with our kids to make sure that they are not exhibiting some of those symptoms of anxiety that we know we see in our particular kids. Because again, nobody knows how our kids manage anxiety better and exhibit those symptoms of distress than us as parents.
Travis, is there anything else you'd like to mention to us today about mental health, going back to school, and the choices that parents have to make in the next couple of weeks?
Did I mention wear a mask?
Yes, but you still can say it again.
Did I mention that this is not an easy solution or an easy decision to make?
You have, but
Okay.
I think that's important. I think, yes, as a parent and as a child, this will not be normal. I mean, I know I'm going back to school in the fall for an MBA program, and so I'm thinking about this stuff too, not from a child perspective, but yes, I think it is going to be a very hard decision, whatever people decide to do and the choices they make individually.
And I just liked what you mentioned earlier is we need to give ourselves time and a break to recover and to relax. And we also need to feel confident about our decisions and not let fear of stigma or judgment get in the way of us making the choice that really makes the most sense for us, having weighed out the pros and cons that are in front of us. So, thank you.
That's a great place to end, and I really appreciate the conversation today. And if you guys would like any further information about back to school, like Travis mentioned, we have a website on Primary Children's Healthcare's page. I'll put that up afterwards so you guys can look over that. We also still have our COVID-19 hotline available that you can call to get screened and find out where to get tested. That phone number is 844-442-5224. We also have an emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Any member of the community can go ahead and call, and they can talk to a trained caregiver about the support that they need during this time. Thanks, everyone, and we'll talk to you next time.